I'm Charlie Bright of Gold Derby, and today I'm speaking with Alex Gibney, the documentary filmmaker whose new film, The Crime of the Century, is currently streaming on HBO Max. The first question I want to ask is, there is so much in this documentary that can make one especially nauseous. But for you personally, what part of this film really made you, for lack of a better term, really made you feel sickest to your stomach?
I think it's the over and over and over again, the willful denial in the service of profit was really made me ill. That people would allow themselves to recklessly overprescribe dangerous narcotics in order to be able to make more money. I mean, that just it's staggering. And it's not just the pharmaceutical companies, it's doctors, it's pharmacies, it's distributors, it's the Department of Justice, it's Congress. You a long time ago, I made a film called Casino Jack in the United States of Money. And I kept hearing that subtitle in the background here, the United States of Money, that's all that seemed to be important here, and then when you see the staggering amount of suffering involved and death, I mean, it really makes your head spin.
Were there any times when you were interviewing people where their answers made you, caught you off guard in any way? I keep on thinking of I think of the guy who owned, what was it, Life Tree in Utah?
Lynn Webster.
Yeah, Webster, and he the way that he would talk about caring for patients when he obviously
Well, there was one thing that caught me off guard that Lynn Webster said. I remember asking him. I said, I understand that as many as 100 patients died at Life Tree Clinic. Was that a high number? And I expected him to correct me and say, no, it was only 50, which would have been a high number. But instead, he said, oh, I don't know. Is that a high number? I thought, whoa, 100 people? And you're asking yourself, is that a high number? That was staggering to me.
So, it's the documentary it's a two-part documentary. But with any documentary, there are always sometimes, things that you're just not able to include in there, even if you really liked them. And I was wondering if there were any stories or angles of the documentary that you found very compelling, but weren't able to include in the final cut for one reason or another.
It's a good question. I mean, this one was pretty sprawling. So in a way, I think that we got in most of what we wanted to get in, to be honest with you. There were many more stories of sales successes, but I think we got what I wanted in. At the end of the day, I think of it differently, this one, because it started out as a 2-hour film and then expanded its borders into a 4-hour. So in that sense, I felt like I got what I wanted in the film.
What jumping off of that, what aspect of the film led it to be expanded from just your normal feature-length documentary to a two-parter?
Well, I think I started out because this started out as an idea that came from a conversation I had with a group of investigative reporters at the Washington Post. And they had been covering more of the distribution stuff. These big distribution companies like Cardinal, McKesson, AmerisourceBergen, and they had a kind of a whistleblower, a guy named Joe Renazizi, who worked for the DEA, and they had a really interesting angle on it. But as they began to tell me the story of opioids in America, it was kind of a 3-act structure that starts with Purdue and OxyContin, leads to people becoming addicted to heroin, and then fentanyl. And I became convinced that I really wanted that the part of the story that hadn't been told, you'd seen bits and pieces. Everyone thinks, oh, I know the opioid crisis. But what you hadn't seen is the breadth of the story, that three act structure or the three drug structure, and the sense of how pervasive it was and how monumental it was and how many people were involved in the crime. It came to me to be a little bit like that Agatha Christie novel, Murder on the Orient Express, where you think it's one culprit and it ends up being a lot of people who had their knives out. And so I wanted to find a way to keep the story intimate, focus on characters, but to tell at the same time a panoramic story of the breadth of the crisis. That's what was so important to me about doing this. And then I felt that that's what hadn't been done from 96 to 2021, to give a sense of how enormous a crime this was, and that it was a crime. That was the other thing that I felt hadn't been done before. We all talked about the opioid crisis as if it was a kind of a natural disaster, like a flood or a hurricane. And I wanted to reframe it as a crime.
And what I thought was really interesting is that you really, with the exception of the legislation that was pushed through, I think in what was it, 2015 or 2014, that was championed by
Tom Marino and Marsha Blackburn.
Ensuring
patient access, and I can't remember the name of it. Yeah, it was actually finally passed in 2016. It was a process that took about 2 years, actually.
But that was really the only really partisan thing you really saw, as well as the thing with Chris Dodd as well. Was that intentional to show that both parties have a reckoning on this, that they are complicit in this?
It's part of the story. I mean, it's not something I set out to do in advance. It's you follow the story, and that's where it takes you. And where it takes you is that law that you referred to, or it was an amendment to a statute, basically undermined the ability of the DEA to go after these big distributors when they were improperly selling drugs to places they knew were likely pill mills or diverting drugs for illicit purposes. So that was passed by unanimous consent. That means everybody in Congress said okay, and Obama signed it. So it gives you a sense of just how dysfunctional our government is, how susceptible it is to the blandishments of money, and many of the sponsors of the bill received lots from opioid companies, but also because our politicians spend so much time raising money, they don't really have time to do the work of government. And so this was a 3-page amendment. Somebody should have read it. Somebody should have asked questions, but nobody did, because they were being told by paid experts who formerly worked at the Department of Justice that it was all good. And those experts were being paid by the very pharmaceutical companies that the bill was intended to benefit. So that was really a dark moment. Few people in government come out well here. And, there were, obviously it was called the Marino bill. He was a Republican congressman from Pennsylvania. And Marsha Blackburn, who is now Senator Blackburn from Tennessee, a state badly scarred by the opioid crisis. They were key proponents and they were Republicans. But yeah, Chris Dodd is a Democrat. And there were a lot of Democrats that were willing to pass that bill by unanimous consent. So it was really it's kind of a shocking look at how broken the system is.
Do you know if there's currently any progress that's being made or any legislation that has been introduced in government to address what companies like Purdue Pharma and Insys, I believe was the other one, did in abusing their sales practices?
I mean, people at Insys went to jail. I think there are a lot of people who feel that Purdue Pharma and the executives there really haven't been held to account. And I go into that a little bit in the film, starting, I'm not sure I'm going to get the year exactly right, but starting around 2008, 2009, the Sackler family starts pulling money out of Purdue, and they pull out about $10 billion. when Purdue started to be hit with all these fines, Purdue went bankrupt. So they're in Chapter 11 bankruptcy. They're operating, but they're in, under the control of a bankruptcy court. So they get hit with a big fine, but they can't pay it because they're in bankruptcy, and the Sacklers have taken all their money out. So, and no executives at Purdue were ever really held to account. 3 executives, I believe, pled guilty to misdemeanor charges, which by consent of the Justice Department meant that they wouldn't have to serve a day and spend a day in prison. So not that much accountability.
They also didn't have to admit any wrongdoing, correct?
I think they didn't have to admit any personal wrongdoing. Obviously, Purdue as a company pled guilty to a felony. So, there was an admission of wrongdoing, and they admitted, the executives pled guilty, I believe, to misbranding, which is pretty low bar. But they declined any fundamental personal responsibility for the opioid crisis. And that was true not only to the executives, but the Sackler family. To this day, they don't feel that they have any personal responsibility for the opioid crisis.
Looking at your career as a whole, you've made documentaries that have spanned so many subjects, from corporate greed to Catholic sexual abuse, Hunter S. Thompson, torture, and Scientology. How do you go about choosing what projects you want to tell the stories
of? Sometimes they choose me, sometimes I choose them. It kind of depends. I get offered projects sometimes projects drop in my lap, and sometimes I run after them. It just depends. But for the ones that I don't choose myself, that are either offered to me or come to me, I always have to go through a process of reckoning with whether or not I want to spend 2 to 4 years of my life, doing this. I mean, the trial, Crime of the Century, took 3 years. So that's usually the reckoning I do. So there's no single answer to that question.
Well, another thing I wanted to ask is, we are an awards site, and you won an Oscar for Taxi to the Dark Side in the documentary feature category in 2007/2008. What was that experience like of, going there and winning that Oscar?
Well, it was potent. I mean, it was potent, and we definitely busted everyone's Oscar pool that year, because I don't think anybody expected Taxi to the Dark Side to win. But we did. And, it was a very moving moment for my wife. She sort of dissolved in tears because I'd been working very long and hard, and without that much fame. I mean, Enron had been nominated for an Oscar and we didn't win. We lost to the Penguins.
Don't remind me.
But winning that was very potent, and it was very moving to get up on that stage and actually be able to deliver a message to millions of people that would invoke both Dilawar and my dad. And my dad was, felt very passionately about making that film because he had been an interrogator in World War II and was absolutely livid about the way that we had transgressed fundamental values. So it was a really potent moment, and the celebration afterwards was pretty good too.
Well, Alex, thank you so much for joining us. We wish you all the best over this upcoming Emmy season. And to all of our viewers, please like this video, smash that subscribe button, and don't forget to go to goldderby.com to make your predictions and see if you can outsmart the top prognosticators in Hollywood. Thanks so much, Alex.
Thank you.